Hi, my name is Dr. Lori Cayley, and you're going to want to watch this video if you have been diagnosed with a thyroid condition such as hypothyroidism or Hashimoto's, and you have gone to your medical doctor who has just put you on thyroid hormones, and you have tried to change your diet based on what you think will help, but you are still not able to resolve your symptoms. I'm a functional medicine practitioner, and I help women who have thyroid conditions reverse their thyroid condition. And I do so using functional medicine testing, and based on the results of the testing, I recommend dietary, environmental, and lifestyle changes in order to get women well and help them to restore their life. So today I'm going to talk about lab tests that I get commonly for my patients. There's a lot of different information out there, and if you can't restore your health through dietary changes and other environmental changes that you may have made, then you need to get some functional medicine testing done, and the proper testing. I even talked to some clients who have had some testing done, but it just hasn't been the right testing, or testing that was actually getting to the root cause of the problem. So today I want to just discuss the different tests that I commonly recommend. There are hundreds and hundreds of functional medicine tests out there. And if you have a good functional medicine doctor, based on your health history and based on your symptoms, they will be able to decide what the best test will be. But commonly, there are some that I will get more common than others, just because a lot of people have symptoms that need the specific testing. So the first one is a comprehensive blood test. And with a comprehensive blood test, we'll get an iron panel, lipid panel. We'll look at a complete metabolic panel and a complete blood count. So I will utilize optimal values instead of the normal ranges that labs give. Labs will take an average of everyone who's been to the lab within approximately the last year to get their normal values. And unfortunately, most people who are getting blood work are sick. So functional medicine doctors do not want their patients compared to sick people, normals. We want them to be in the optimal ranges. So I will analyze that blood work and get the optimal ranges. If anything is out of range, then we can decide how we're going to go about fixing that and getting it into the optimal range. And the next thing that we look at are thyroid hormones and thyroid antibodies. So we look at free T4, total T4, free T3, total T3. We look at TSH levels and reverse T3. And then we also look at thyroid antibodies. So thyroid peroxidase and thyroid globulin are the common antibodies that we look for to see if there is a possible autoimmune condition that is present. And that is very common with people who have thyroid conditions, is to have Hashimoto's. About 90% of people who have a thyroid condition have Hashimoto's. So we want to figure out if that's going on. If it is, then we obviously are going to look for the root cause of that. The problem is not the thyroid gland. If we do find that it's Hashimoto's, it's an autoimmune condition. So your autoimmune system is just not functioning the way that it should. So we want to find out why, and that will lead us into the functional medicine testing. So a common test that I like to get is called the organic acid test. And this will look at nutritional deficiencies. It looks at functional vitamins and minerals to see if there's anything out of range there. It will look for amino acid insufficiencies, detoxification pathways, neurotransmitters. It will look at the mitochondrial cell energy production and methylation and some other things as well. It's a great test just to see generally how the body is functioning. And another test that I really like is the Dutch test to test sex hormones and the adrenal glands, and it also will test their metabolites, and we can also look at neurotransmitters through the Dutch test as well. The thyroid gland, the adrenals, and the sex hormones all work together, so we need to get a good picture, and that test is really great for looking at those things. The next test that I like to get is a comprehensive stool sample. There are different ones out there, like the GI map. This is great because most patients, through research, it is now being shown that people who have an autoimmune condition also have leaky gut. And many of the symptoms that come up with thyroid issues, hypothyroidism, are mood issues, anxiety, depression, and we look to the gut when we see those symptoms because your gut is your second brain. So if your gut isn't working right, then it's not communicating well with your actual brain. So we have to see if there are bacteria, viruses, parasites, pathogens in the gut. And if there are, we need to obviously clear them up. And this helps so much in restoring health and restoring those symptoms that I had just talked about. SIBO test is also great. Small intestinal bacterial overgrowth is very common these days, so it's important to look at that and see if that's going on. And then I also usually find that with people who are having a hard time getting better, have underlying infections. So common ones would be Epstein-Barr, cytomegalovirus, and H. pylori. So if you have a good functional medicine doctor, they're going to want to investigate, see if you do have those hidden infections in your body. I have an undergraduate degree in microbiology, so I am great at finding these hidden stealth infections because I really understand how viruses, bacteria, pathogens operate, and I know how to get the testing done and get my patients well fast. So if you have any questions, you can comment below or message me on my website. My website is www.drloricayley.com. Thank you for watching.